is coming. Hey, are you ready? The D-Day is coming. Hey, are you ready? Hey, good day from anywhere in the world you're watching. My name is Nurse Veronica Ubi. And are you ready for delivery? Just calm down, calm down. Take a deep breath, breathe in, breathe out. It's going to be a smooth journey. When it's time to have your baby, some modes of delivery may be recommended to you as need be. I'm here to tell you beforehand of the different modes of delivery so you know and can make an informed decision when it's time. So there are 5 modes of delivery. The first is called the spontaneous vaginal delivery or unassisted vaginal birth. And this is the most widely known form of delivery. This is when a baby is delivered through the vagina unassisted. There are benefits and there are risks of having a spontaneous vaginal birth. Some of the benefits are a shorter stay in the hospital, faster healing for the mother, faster initiation of breastfeeding, lesser risk of infection, and a lesser blood loss. Some of the risks include soreness and pain in the vagina. There may be weakness of your pelvic muscles and your vaginal muscles, which may interfere with sexual intercourse for a while. You may experience urinary incontinence. You may experience constipation. There may be trauma to your birth canal and trauma to your baby. The second mode of delivery is the assisted vaginal delivery. And this is where procedures are done to help bring out your baby from the vagina. It's usually done in cases of prolonged second stage of labor. There are 3 forms of assisted vaginal birth. The first is called the forceps delivery. This is where a delivery forceps, usually blunt, is used to grasp your baby's head and guide it through the birth canal and eventually out of the birth canal successfully. The second form of assisted vaginal birth is the vacuum extraction. So here a suction cup is placed on your baby's head and is connected to a pump. So as you push gradually, the pump and helps to bring out your baby from the birth canal. The third is called the episiotomy. This is a small surgical incision that is given in your vaginal tissues, and this is done to create more space for the baby to come out. It's usually done in cases where there's a fetal distress and your perineum is tight and your baby is larger. Some of the benefits of the assisted vaginal birth is that it abruptly ends the prolonged second stage of labor and is an alternative to the cesarean section. The risks include trauma to your baby and to your birth canal and other risks associated with vaginal births. The third mode of delivery is the induced vaginal birth. This is where labor is induced using drugs and other measures. It is done mostly when a woman has passed her expected date of delivery or some medical conditions such as preeclampsia, eclampsia, or gestational diabetes, that's pregnancy-induced diabetes. And there are benefits as well as risks. The benefits include a stronger and faster contractions, relief of anxiety in a mother that has passed her expected date of delivery. Some of the risks include increased pain from the contractions. There could be a uterine tear, that's a tear in your womb, and other risks associated with vaginal births. The fourth mode of delivery is called the cesarean section or CS. This is a surgical procedure that is done to get your baby out of the womb. It's usually an incision given in the lower abdomen, and this procedure takes about 30 minutes to an hour. You could have an elective CS or an emergency CS. An elective CS is a pre-planned CS, and then there is the emergency CS that comes up in cases of emergency. Some reasons for an elective CS are maybe your choice. You choose to not have a vaginal birth and you want to have a CS done. It could be as a result of multiple pregnancies, a big baby, and other conditions. Some of the reasons for an emergency CS could be hemorrhage, a prolonged and obstructed labor, there could be a cord prolapse, and other conditions. Also, there are benefits and there are risks of having a cesarean section. Some of the benefits include less trauma to your baby and to your birth canal, less trauma to your vaginal and pelvic floor muscles that may have interfered with sexual intercourse. Some of the risks could be a longer stay in the hospital, a longer healing time. There could be a risk of increased blood loss, there could be a risk of infections, and also there could be the side effects from the anesthesia. Some of these side effects could be headache, numbness in your lower limbs, back pain, and discomfort. The fifth mode of delivery is the vaginal birth after CS, or you can call it VBAC. This is when a mother chooses to attempt a vaginal birth after she has had a previous CS, which is possible if the following reasons are obtainable. Some of these reasons are the previous CS is 2 years or more, your baby is not too big, your pelvis, which are the bones that are responsible for delivery, are roomy enough, you don't have a multiple pregnancy, and the incision given during the previous pregnancy was in the lower abdomen and it was horizontal. So, whatever the case may be, discuss with your healthcare provider and make an informed decision. Bottom line is, at the end of the day, mother and baby are in great condition. All right, do have a beautiful time till we meet again very soon. Bye bye.